A sighted person receives most of their information about the world through their eyes. Small wonder that people have gone to such lengths to restore clear vision. Yet for those whose sight was dimmed by cataracts, eye surgery remained a forbidding prospect. Until now. The delicate powers of sound and light have been harnessed to help cataract patients, to give them a world of new vision without pain, without hospitalization, with less cost. This is the eye. The cornea focuses light from the world through the pupil and into the lens. Focused further, the light is projected onto the retina and becomes vision. But we age. The lens, regenerating new cells from birth, cannot lose the old dead cells. They cloud the center of the lens. A cataract is created. Colors fade. Sharpness dims. What if we could gently liquefy that hardened, milky obstruction, remove it, and substitute a new crystal clear lens?
And the procedure is called phacoemulsification.
We can.
This small probe vibrates at 50 kilohertz, really what you'd call ultrasound. That liquefies and rinses out the cataractus lens. Using phacoemulsification, the opening in the eye is only about 1/8 of an inch wide, and the pressure in the eye maintains near normal the whole procedure.
You see, even in a mature cataract like this one, the probe will liquefy it. Once we have removed the cataract and clean out the original lens capsule, then we take this tiny little lens and implant it within the eye using these fine loops to hold it in place and position it correctly within the eye.
The new vision is startling. But there are other considerations to eye surgery besides state-of-the-art technology. Fear is the main one. How can the patient's natural anxiety be diminished?
Good morning.
Good morning.
How may I help you?
The name is Booth, R.D. Booth.
All right. Have you been in to see Dr. Ford or Dr. Haidar before?
Yes, we have.
Okay. Mr. Booth, is your address 702 F Street, Centralia? And do you still have Medicare and most kind of insurance? Thank you very much.
We both started now.
Mr. Booth?
Oh, yes?
Hi. Would you like to come in with me? Mrs. Booth?
But the real problem, especially in the older patient, can be the anesthesia and sedation. We've discovered that it simply is not necessary to sedate the patient if you create an environment of relaxation. The procedure is done under local anesthesia, and as soon as it's over, the patient stands up and walks right out of the operating room. We call this the sedation of assurance.
Hi, Mr. Caroline. How do you do? Come on over to this one. Good. She's busy place. There we go. Okay.
Hi, Elsie. Well, hi. How you feeling? Fine.
In this kind of surgery, warmth, compassion, and humanity go hand in hand with the leading edge of medical technology.
And the pressure of your eye. You can go ahead and have a bite of lunch if you like, and your family's welcome to come and view your surgery.
Here's some orange juice for you to drink, Mrs. Headland.
Oh, that looks good.
Yeah, a little dry after surgery.
Yes.
To serve both of these seemingly contradictory interests, you would need to create a very special facility.
The surgery is a piece of cake. It's easier to go into the...
You would need a sensitive and caring staff, skilled in dealing with the special needs of cataract patients.
Schedule that for ya.
You would need to invest in the finest state-of-the-art medical equipment and stay constantly abreast of the latest developments in the field. You would need to have unique architecture, specifically designed to aid the patient and their family in reducing anxiety over the procedure.
Here we have a lens, a sample of a lens that the doctor is inserting.
How tiny.
You would need to have two of the most highly skilled cataract specialists as surgeons, each having performed thousands of operations. You would need to create a Pacific Cataract and Laser Institute. Dr. Robert Ford and Dr. Helgi Haidar built this facility on a wooded hillside in Chehalis, Washington. To the patient and their family, the specialization on cataracts at PCLI means outpatient surgery. The patient can go home within 30 minutes of surgery.
We're measuring the curvature.
If they desire, the family remains with the patient throughout the preliminary examinations. Special care is taken for each patient's individual needs.
She does have a cataract, but fortunately cataracts are easy to fix nowadays. There is one other test I need to do. This instrument projects the eye chart around the cataract, and it tells us about what she'll be able to see after the surgery is over. Can you see any of the letters in there?
Viewing the surgery through a glass wall, the family can talk with patient and surgeon via intercom.
Adjusted the tension of the sutures. This will change the shape of the cornea and minimize the degree of astigmatism that the patient would have afterwards.
A television monitor shows the microscope view. In phacoemulsification, the level of potential complications is dramatically reduced. But the demands on surgical technique require that the surgeon have substantial experience with this procedure.
Thank you.
The surgical team at Pacific Cataract and Laser Institute are specialists. Their expertise is exceptional. In any cataract surgery, up to 1/3 of patients may experience a clouding of the back membrane of the lens capsule. If this so-called secondary cataract occurs, the YAG laser comes into play.
Laser is quick and easy. You'll feel
Aiming with a harmless red laser, the doctor fires the YAG, painlessly opening microscopic holes in the obstruction. Clear vision is miraculously restored. A world of new vision for the asking.
Pacific Cataract and Laser Institute was founded on the idea that with state-of-the-art techniques, patients don't need hospitalization or sedation. What they need is a caring and competent staff and a level of surgical skill that only a cataract specialist can provide. Apparently, the public feels the same, for the response is overwhelming. This just confirms our commitment to giving our patients the finest in surgical technology with a warm, personal touch.
My arms and say video. Okay, right.
Several of our children wanted to see the knee video, and the others said, no way. No way do they want to see that. So I don't suppose that
You want to see this either?
they'll want to see this. Several of them did, but...
Hi, Ted. My name is Larry, and I'll be narrating a cataract surgery for you on your videotape. And this here's your eye magnified about 35 times on the TV monitor, and Dr. Ford's performing the cataract surgery. Right now, he's cutting back the conjunctiva. It's a real thin membrane that covers over the white part of the eye, which is called the sclera. The conjunctiva protects the eye from bacteria and also keeps foreign objects from getting back in the back orbit of the eye. When the surgery is completed, he'll just lay that thing right back down again, that little membrane, and it heals in about 4 hours, one of the fastest healing tissues in the body. He just cauterizes off the little vessels, the amount of blood lost during the surgery is actually less than 2 drops, very, very little. He now dries off that little sponge, that's that sponge right there. He now marks off 1/4 of an inch. The incision itself is only going to be 1/4 of an inch long. He makes the incision with a diamond blade scalpel. The scalpel itself is very, very small. It's only 1 millimeter wide, about the size of a hypodermic needle. He makes the incision between the 2 layers of the sclera, the white part of the eye, in such a manner that the incision is self-sealing and there's no need for any type of sutures or stitches. It seals right together when the surgery's been completed. You see how far that thing had to go just to cover 1/4 inch, so you know it's really small. It makes 2 secondary openings, one on the top and also one on the right-hand side. Again, these 2 openings are about the size of a pinpoint, very, very small. He'll be adding real small instruments and also be adding fluid to the eye in those little openings during the surgery itself. Right now in the top of the opening, he's putting in a little hook instrument. He's making a circular tear in the front part of what you call the lens capsule membrane, which is like a little cellophane sandwich bag. Goes all the way around. It's like a little cellophane sandwich bag in which the lens is inside of. So he goes completely around. See how thin that thing is? It's very, very thin. So he can get to the lens itself to break it up. He's now going to be making the inside opening to be 1/8 of an inch. This little diamond blade here is only 1/8 of an inch across. And it goes right down to the anterior chamber, which is behind the cornea, the clear part of the eye, and right for the iris, the clear part of the eye. He now adds some fluid between the outer edge of that lens capsule membrane to separate it away from the lens, because that membrane fits pretty tightly around that lens, and they want to get it loose, put fluid between it and the lens so the lens membrane won't be damaged by the phacoemulsifier when they break up the lens. And this here is the phacoemulsifier instrument, the ultrasonic instrument. The little silver plunger there at the end vibrates at 50,000 times a second by ultrasound. It acts as a mini jackhammer. It just breaks up that lens into little particles, little pieces, and then sucks it right out to the center of that silver tip, which is also hollow. So it just breaks it up and sucks it right out. And just above that silver tip, you notice a little opening on the right-hand side, like a little hole or an eye. There's actually two of those, one on each side. There are two little portholes in which fluid is being put into the eye at the same rate as the fluid has been taken out of the eye. That helps maintain a constant pressure inside the eye and also helps wash up particles out that are being broken up by the phacoemulsifier itself. The nurse keeps on putting fluid on the front part of the eye, right there, that saline solution that keeps the cornea and the eye moist, keeps it from drying out. Since he can't blink, there's no tears being produced to keep it moist. Okay, the main part of the lens is gone already, and what's left around the edges looks like little cobwebs up there toward the top. That's what you call the lens cortex, which is the outer soft tissue of the lens that kind of sticks in places to the lens capsule sac membrane in the back. So he now just kind of polishes it off, make sure everything's out of that sac, so nothing will get in the way of Ted's vision once they put that new artificial lens right back inside that same little sac. So they make sure it's all cleaned out, kind of polish off the inside there. You see how thin that back membrane is too, how it wrinkles when he touches it back there. Okay, right now Dr. Ford is making the inside opening to be 1/4 of an inch to match that of the original outside opening of 1/4 of an inch, which is now just big enough to get into the eye. Yeah, not very big. The new intraocular lens, which also happens to be 1/4 of an inch in diameter. The intraocular lens is made of a high-tech plastic. It's one piece, has two little attachments called haptics, which act as little springs to help maintain the position of that lens inside that lens capsule sac. So he puts the lower haptic in first, and now grabs onto the upper little spring thing, rotates that around, and flips it right in the little bag, and the lens is centered. He keeps adding fluid to the eye, which builds the pressure up, which seals off the upper incision. He brings down the conjunctiva, which will heal in about 4 hours or so. He now adds more fluid to the eye and just kind of taps on it, make sure the pressure is okay inside. He takes out the eyelid speculums, which held the eyelids open, and Ted is all done. So now the nurses will be putting some antibiotic drops in the eye and put a patch on it, which he can take off this evening before he goes to bed. And then he'll be going back to the TLC room for about 10 minutes of instructions. He'll be ready to go. Actually, he can take it off. I don't know what time he goes to bed. Right now it's 4 o'clock. So about
11 o'clock noon.
9. Okay, you can take the patch off about 9. Should be all waking up by then.
And his vision afterwards is blurry?
It should
Is
be.
there light and dark?
It might be a little. Oh no, he'll see. Yeah.
But light, you'll see.
Right. Yeah, he'll see. Yeah, he'll see almost everything. Might not be perfectly clear yet. Might take a couple of days to clear up completely, but he'll see. Get around and walk around and wherever.